Hello, everyone. Thanks for joining us for our second foster Zoom session. It's a great day to talk about some kittens. If you were there for our first session, our first topic was talking about some of the basics of puppy care and preparing your house for bringing a new foster puppy home, things like that. So today we're going to focus a little bit on the kitten side and make sure that all of our fantastic neonatal fosters, especially if they're new, kind of know how to get started. So let's go ahead and just jump into it. We'll try to keep this as informative as we can, and then at the end we'll have a question and answer portion. So you can ask questions rather with the question and answer feature, or you can type into the chat if you have a question at any time, and we'll answer it during our question and answer session. Just make sure in your chat box it says to all attendees and hosts and panelists. That way everybody can see what you're asking. Or if you use the question and answer feature, there's a couple different ways you can do that. So, all right, well, let's jump in. So if you don't know me, my name is TJ Trevino. I'm the development coordinator with San Antonio Pets Alive. I've been in a couple different roles, and I've been here a little under 2 years. It'll be 2 years in August. And I actually used to be a dog person. So I had a little poodle for a while, and then I ended up, as soon as I started working at SAPA, I ended up with Otto, who you can see in my little picture there. He's my big fat orange and white cat. And kind of since then, I've sort of become a cat person. So I kind of put my best foot forward in learning all about cats and kittens and things like that. And I started fostering usually singleton kittens, just the ones that are on their own. So I actually have one right now. But and with me today, we have one of our wonderful fosters. She's a kitten foster, and she has a lot of experience with cats and kittens, and especially like medical cases. So if you'll welcome Miss Maria Matacola. Maria, if you want to introduce yourself, say a little bit about your experience.
Hi, my name's Maria, obviously. I actually have experience in a wide range of animals. Part of my job is working with wildlife, and I've bottle fed anything from tiny little weird wildlife animals to dogs and cats and kittens, and all sorts of things. So I kind of have a little bit of experience everywhere, but I primarily focus with cats and kittens, especially when it comes to fostering, because of my living situation. It's just easier not to have to deal with puppies and dogs. So that's why I do the cats and kittens. I like them a little bit more because they're a little bit less messy than puppies. So
I agree.
I've been fostering with SAPA now for 2 years and have fostered well over 200 animals with them. I think I'm coming up here close on 300 already. So
It's just incredible. I've done maybe like 2, and I'm like, oh gosh, this is so many. So me and Maria are going to kind of go back and forth. We're going to talk about some great topics, just some basics that, you know, all the neonatal fosters, kitten fosters rather, should know before they really get started and jump into fostering kittens, because it's good to kind of get as much information as possible before you get started. So what is a neonatal kitten? So if you don't know what that is, neonatal kittens are usually considered, you know, at birth up until 4 weeks. But most of our neonatal fosters, well, some of them, will usually hold on to them until they're about 8 weeks, which is when they're ready to get spayed and neutered and they can be adopted out. But technically, neonatal kitten is up from newborn to 4 weeks old, and they usually require round-the-clock care. So bottle feeding or just feeding every couple hours, you know, making sure that they are going to the bathroom, making sure there's no signs of illness. So there's a lot of heavy-handedness with some of the really little ones, especially when they don't really have a mother cat to take care of them. So if you're interested in fostering a neonatal kitten, there are a couple ways you can find out about the kittens that are available that we get in. So we usually have what's called kitten season. This year it was a little different, which was strange, but usually kitten season will run kind of towards the end of February into March, and then all the way to October. And then between October and January, usually in the winter, is when we don't get as many kittens in. But in that spring, summer portion is when we get quite a few of them in. So if you're already on our foster emails, you see, you know, we get a few every couple days. So if you're interested in finding those neonatal kittens, you want to make sure you're signed up for our foster emails. And if you're not, you can email them at foster@sanantoniopetsalive.org, and they'll get you on that list to make sure that you see whenever we have kittens available. Or you can go onto Facebook, and there's actually a group that's called SAPA Urgent Neonates. And that is also where they post a lot of the neonatal kittens and puppies. So you can join that group and respond to posts if you see them with kittens that are available for you to foster. And then we can make sure and get you set up. And the sooner we can get them into foster homes, the better, because, you know, Animal Care Services doesn't really like holding on to them. So the sooner we get them into a foster home, the better that they do. So that's a neonatal kitten, and that's what our neonatal kitten fosters rather, are really good at. So let's talk a little bit about kind of their development and sort of how you can age them out. And obviously every kitten is different. Some of them will grow at different rates. My foster right now, I want to say she's about 3 weeks, but she's still pretty underweight. So they can differ just like you and me. But so this is kind of the first 3 weeks. I mean, it goes up to 2 weeks, but this is like the first 3 weeks of their life. From 0 to 3 weeks, when you bring these little kittens home, you want to kind of get your area prepared. So these little ones are best done in like kind of, my preference is to have them in a tub somewhere where you can easily reach in, reach out. They're small enough that they can't jump out. So, you know, line that as a little nesting box with blankets and a heat source. And usually you won't need a litter box when they're this little because they haven't quite got the grasp of that yet. You'll be helping them for the majority of that. So that's sort of what you want to really focus on, is just making sure that they're comfortable and they're in a place where you can easily get to them, you know, to feed them or to stimulate them or to just, you know, relocate them if you need to. So when they're newborn, you can see in the picture here, I love these little newborn kittens, but their eyes are closed, their ears are folded, so they don't really have any concept of really, you know, where they are. They'll be responsive in your hands still a little bit, but they won't be able to see or hear you. And some of them, when they're newborn, they might still have the umbilical cord attached. So you want to just leave that alone. Usually it'll fall off on its own. And you never want to, you know, try to cut it off yourself, because that could, you know, cause a wound or some kind of infection. So you want to let that fall off naturally. And when they're this little, they can't regulate their temperature. So you'll absolutely need a heat source to keep them warm. Their average temperature, body temperature rather, should be between 95 and 97 degrees Fahrenheit. So anything that'll keep them at that comfortable temperature, you'll want to keep in their enclosure or their box or wherever you're keeping them. So after about 1 week, their ears are going to start unfolding at about 7 days. So they'll be able to, I mean, their hearing isn't fully developed, but you'll be able to see the little pointiness kind of coming out of their ears. Their eyes won't start opening until between 8 and 12 days. And of course, some kittens may take a little longer. Some may do it a little sooner. So you'll just want to keep an eye out for sort of one eye maybe opening before the other, but you never want to force them open. They'll do it on their own. And they don't really, once they do have their eyes open, they still have pretty poor vision. So they won't be super responsive if you're waving in front of their face or anything. But their average temperature now should be between 97 and 98. You'll still want to keep a heat source with them. For week 2, their eyes should be fully open at that point. They'll have small little rounded ears, kind of look like a little bear cub. So their senses will be developing, but they still don't have any teeth, and their claws are still unretractable. So they'll have them out at all times. And if you've ever fostered kittens before, you know that they're like little needles, so that's really fun. And they might start trying to move around at this point, but they'll be wobbly. They're not super coordinated. And then their average temperature is about between 98 degrees and 99 degrees. So again, they'll still require a heat source until they can really regulate it themselves, especially if you prefer to keep your house a little cooler. I know I do, so I make sure that my kitten has a heat source at all times. So we're gonna go to the next one. So this is 3 to 5 weeks. This is when they'll start developing their little kitty senses a little better. So in week 3, you'll be able to see the nice blues of their eyes. Every kitten has blue eyes. They won't start getting their adult color until they're a little older. They'll slowly begin to be able to retract their claws, but it'll take a little bit for some kittens. So you never know. Just be careful that they don't poke you in the leg or anything if they're exploring. Their average temperature now should be between 99 and 100 degrees. So they're getting a little warmer, a little better at regulating their temperature. But I always recommend, honestly, just giving them a heat source until they're maybe 5 or 6 weeks, just to be on the safe side. So week 4, they're beginning to kind of get coordinated a little better. They're starting to learn social behavior, especially if you have a litter at home. So you'll see them start to interact with each other, kind of. That's how they learn their manners from each other, make sure that they understand each other. So that's a good thing to have, especially if you have a litter of kittens. And their claws are going to start to be able to retract all the way. So you'll see their little soft paws. It's not as painful to have them walk on you. And then their average temperature should be between 99 degrees and 101. So week 5 is when their little teeth start coming out. And this is when you can kind of start weaning them off of food, or off of formula rather, and onto some wet food. But I'll let Maria talk a little bit more about that in our next section. They'll be able to run and play confidently. And at that point, they'll be able to kind of, they should have perfected the litter box. Usually they'll start litter box training rather at about 3 weeks. So by 5 weeks, they should kind of get the hang of it and be able to go in the litter box regularly. So you'll want to keep a shallow litter box with them. And about week 5, like I said, you probably won't require a heating source as long as your atmospheric temperature in your home is between 70 and 75 degrees. So if it's any colder than that, then you'll still want to give them some kind of source to make sure that they can keep warm. And then week 6, let's go to the next one, week 6. This is when all their little milk teeth have emerged and they should be able to eat on their own. Of course, some might take a little longer than others. Some might be fussy and still want to, you know, do certain things or eat certain ways. So you'll have to be patient. One thing I learned from one of Kitten Lady's video, who I watch a lot, she says kind of meet them where they are. So I usually try to do that, kind of don't try to rush them. So at week 6, their vision and hearing have fully developed. So they'll be, you know, reacting to you and their litter mates and everything around them. And they'll be able to socialize with all of their friends or litter mates a lot more confidently. Week 7, they should have all of their baby teeth. And that's when their eye colors should start changing to their adult colors. And that's also when a male kitten's testicles might start to descend. So you want to keep an eye out on that. And they'll also receive kind of a spike in energy. So they'll be super playful. They may not sleep as much. So get ready because they're a lot of trouble at that age, I think. And so at week 7, they should be receiving lots of wet kitten food, dry kitten food if you want to offer that, and then water and the litter box pretty much at all times. So you want to have kind of a big enclosure to keep them in. And then at week 8, they're pretty much ready to go home. They can be spayed and neutered once they reach 2 pounds, and they'll be energetic and independent, and they'll be playful, depending on if you have other kittens in the house. So by week 8, they're pretty much ready to go. So you'll age out your kitten just depending on how many of these milestones they hit. But of course, you just want to keep in mind that there are special cases, you know, as with everything. And we'll get more into that also at a later time. So let's keep going. So this is kind of like an array of supplies that you might want to go get, or rather that you'll probably need, but you know, the brands are totally up to you. This is kind of what I use. So obviously you'll want to have formula, kitten milk replacer. I went and got some today because I ran out. A nursing kit, which comes with a bottle. There are some that come with more. Just depending on, you know, if you just want one or if you want a whole array of them. There are different sizes of kits. You'll want a shallow food dish. So if you want to start feeding your kitten wet food, or what we call gruel or slurry, if you're more familiar with that, it has to be shallow because if it's too deep, they probably won't be able to effectively get in there, and really kittens like to get messy at that age. So the more shallow it is, you can kind of judge how much they're eating. And then as they're getting weaned, you'll want to get, you know, wet kitten food and then dry kitten food, whichever brand you prefer. What I like to do is the brand of the wet food that I have, I go with the same brand when I move up to the dry food. So, but it's up to you. You'll want to have a cardboard carrier in case, or a crate if you prefer that, just for transport if you ever need to go to an appointment or anything. A heat source. So I swear by the Snuggle Safes. Other people have preferences, but I love the Snuggle Safe because you can microwave it several times and you know, it'll stay warm for a good amount of time, and it has the instructions straight on the disc. And it's reusable, so, and you don't have to plug it in. So it's great for transport if you have to take your kitten in a car for whatever reason, or moving from foster to foster. It's great, and it comes with a cover, so it's really handy. Baby wipes are good for cleaning up after food messes or cleaning up if they have a poop explosion for whatever reason. It's just good, but you want to get something that's fragrance free. You don't want anything that has strong perfumes or anything like that because their smell is really sensitive. So if it has no scent or anything, that's always better. Of course, you want some blankets, keep them nice and comfortable. Little baby blankets are always good, kind of the thinner ones, and you can maybe layer them, but having enough so that you can change them out because they will get messy sometimes. So if you have enough that you can switch them out. I'm personally using an old t-shirt that I don't use, and it's white, so I can see any mess that happens on there, but that's my preference. I also do that in case I'm worried about fleas. So I'll get a white t-shirt. That way, if there's any fleas or anything on there, I can kind of see if they're falling off of her or if the dirt is falling off of her. So Dawn dish soap is always good for fleas or just a little bit of messiness in general. It's kind of, it'll dry their skin out though, so you don't want to use it too often, but it's definitely good for killing fleas. Caro syrup is good for supplement in case a cat or a kitten starts getting hypoglycemic or they start fading. It's kind of a good emergency supply. A kitchen scale, you absolutely need to have some form of scale or method of weighing them because if you're not tracking their weight, it can be very easy for them to start losing weight and you don't realize it. So kitchen scales you can get Walmart, HEB, any grocery store for like $10 to $12. That's where I got mine and it's come in handy. If you have older kittens, a covered playpen, always handy because as soon as they're old enough to climb, they will be old enough to get out of anything that doesn't have a top. So go get one of these playpens and you could just keep them in there until they're ready to go to their adopter. And it's easy to clean up because it's made out of like a vinyl or, well, most of them are. So your favorite brand, your favorite color, whatever you want, but those are handy, especially if you, you know, during times when we don't have COVID or anything, we like to have adoption events and things like that. So these are definitely handy for those kinds of events. You just put them in the playpen and they're safe. And then I use a non-clumping litter. I use feline pine, and it's pine, just little pine, not chips, they're pellets rather. And it's non-clumping, so they can't really eat it, but it's really easy to clean and it kind of hides a lot of the smells. So I always have a good sort of experience with feline pine and it's pretty cheap for the big bag that you get. So, but of course you can go with whatever brand you prefer, but a non-clumping litter is important because kittens will sometimes try to eat it. So anything that they can't eat is a lot better. So that's kind of what I like to start with. Some of these are what I prefer. Of course, you can go with whatever brand you're comfortable with, but these are kind of the go-to things that you want to have. And I just keep mine in a plastic bin when I don't have any kittens and I just store it somewhere and it's ready to go if I bring home a kitten. All right, so Maria, do you want to talk a little bit about feeding and weighing and what people should keep in mind?
All right. So really one of the most important things, if not anything else about neonatal care, is keeping them fed and making sure that they are continuing to gain weight or at least stay stagnant if it's one of the like special needs kittens. You never want them to be losing weight. And that's really important. So especially if you're new to fostering and you're just kind of getting the hang of how fostering works and trying to learn how the kittens grow and getting accustomed to that, it's really, really important for you to make sure that you weigh pretty much every feeding. Some people weigh before and after each feeding. That's kind of a personal preference. When you're first starting out, it's probably a good idea for you to get the hang of feeding or weighing before and after so you can monitor how much your kitten is intaking in formula. So the feeding all depends on a whole array of different things. So when you first bring home, especially like a newborn kitten or a premature kitten or something that maybe didn't have a whole lot of time to nurse off of mom yet, they might need a lot more help with the feeding portion and stuff that's coming off of mom. So somebody found it and they turned it into ACS and it hasn't been at ACS for very long. So it hasn't had the opportunity to be bottle fed for very long. Those guys are also going to need some time to get used to suckling from a bottle, and just the formula in general. So sometimes they can get an upset stomach from the formula when they're first starting out with eating. And so that's another reason why it's really important to weigh them, so that you can make sure that they're gaining and definitely not losing weight, because that's an indication that something's wrong and you might need to start them on meds or maybe change the way that you're feeding them. So we have this chart, and it goes by ages, and the weights are kind of an average weight for those ages. So some kittens might be a little bit smaller for their age, or some kittens might be a little bit bigger for their age. So that's kind of a general idea of what you should be feeding per meal, and how often you should be feeding them. But just like humans and every other babies, not everyone is going to eat the same or eat the amount the same. So they might be a little bit more finicky with meals at first. So if you can't get a whole lot of food in them at one sitting, if you can't get the full amount that you need, try breaking the feeding up to smaller meals more frequently. So let's say for the 0 to 1 week, the chart says you should be feeding 2 to 6 meals per feed and every 2 hours. Okay, but you might not be able to get only maybe 1 meal in the kitten before it starts getting finicky, pushing the formula out of its mouth. So then maybe you go to every hour you feed it a meal, or every half hour you feed it a meal, and just kind of just break it up to what they need to make sure that they're still growing. And then as they start getting used to the formula or suckling or all that stuff, then you can put a little bit more each meal and further apart. Neonatals are weird. They don't, we have this idea that we want them to be on this schedule, or we want them to be in this ideal little bubble, but they don't work like that. Animals don't work like that. They don't work on our schedule, they work on their schedule, and we just kind of have to go by their schedule, but make it work to what we need them to do, which is we need them to grow. So for the 0 to 2 weeks before their eyes are opening, it's really important to feed them frequently. And then once their eyes open, you can go a little bit more time in between each feedings. So you might have some kittens that eat and or nurse from a bottle, and then they start trying to wean. You can wean them at starting 4 weeks old. But you might have a kitten that wants to go and nurse all the way to 6 weeks or all the way to 7 weeks. Some of them are like that. So yes, we have these schedules and these ages of food groups where you can start gruel at 4 weeks, and then at 6 weeks it should be eating wet food, and at 7 weeks it should definitely be on dry food, or however that works. But they won't all do that. So don't stress too much about them as long as you're keeping them fed and they're gaining weight. That's really the most important part about this.
Mm-hmm. Good. Yeah, so this, like she said, this chart is really just sort of guidelines. So it's just good to have, but you want to make sure, again, that you're meeting your kitten where they are. So let's keep going. All right, some common health issues that are pretty common with kittens. I've had to deal with couple of these, and I'm sure Maria has had to deal with all of them at some point. So for constipation and diarrhea, those are pretty common in kittens. Doesn't mean that it's okay for them to have it, but it's common. It does happen. So for constipation, basically you just want to keep monitoring that. Sometimes if you're switching food, or like if you introduce formula or take away the formula, it can either stop them up or make them runny. So you never really know. It just depends on the kitten and their stomach and kind of what they've been exposed to and what they've been adjusted to before they end up with you. But constipation can also be caused from dehydration and blockages, things like that. So usually the best thing to do is, if your kitten hasn't pooped, no matter what the age, if it's been about 48 hours and they haven't pooped, you'll want to probably bring them to the clinic just to get checked out, make sure that everything's okay. You know, it could just be that they're just stopped up and it happens. So they'll give you the best sort of means of tackling that and getting their systems moving again. And diarrhea, the same thing. It's pretty common in kittens, but it is sort of a sign that something's kind of funky. So you want to, you know, keep an eye on it, especially because diarrhea can cause dehydration. And it can become fatal pretty quickly. So that's something you want to keep an eye on. And I think a lot of the fosters swear by pumpkin for diarrhea, because it tends to sort of firm things up a little bit. But
keep in mind, too much pumpkin is also a problem.
Yeah, so you want to keep it in moderation there. But yeah, so you want to keep an eye on it for sure and make sure that it's addressed as quickly as possible so that things don't sort of start collapsing and causing a domino effect, because it can definitely happen in kittens, just being as fragile as they are. Then you have fleas. Fleas are pretty common for any kittens that are found outside. My first foster came with a bunch of fleas, and I didn't even notice it until, you know, he'd been with me for a couple days. So fleas you can usually check just by looking through their fur. Some fleas can get pretty big, so you can see them with your eyes. But if your kitten has a lot of fur, they can be pretty good at hiding in there. So one good way to check for it is if you sort of just rub kind of a wet, a damp rag or paper towel, or use a flea comb, and you come out with little black specks. That's usually what's called flea dirt, which is usually the eggs for the fleas. So it's not good. You don't want those to be in there. And so that's the sign that you need to give them a little flea bath with the Dawn dish soap or another baby, sort of baby shampoo or soap, or, you know, a kitten specific soap. Just depends on your preference. But I've had some success with Dawn. I've usually only had to give them 1 or 2 baths over a couple days before the fleas are gone entirely. So, but fleas are common. You just want to get rid of them as soon as possible so that they don't continue to snack on your kitten, because that's not good. Then you have upper respiratory and eye infections. Oh, I skipped ones. Internal parasites. So there are a couple different parasites that can happen or can end up in your kitten. So there's things like roundworms, hookworms, tapeworms, coccidia, and giardia, I believe. So with any of these, you want to make an appointment to get something to handle that. So you want to make an appointment with the clinic, and they'll give you dewormers or whatever medication is necessary to get those parasites out. And usually we'll have, all kittens, I believe, get preventatives once they're free and clear, just to make sure that those worms don't occur again, because they can cause a lot of havoc, especially inside the digestive system, or and they can easily be fatal. So those are something to be addressed really quickly. Upper respiratory and eye infections, those are also really, really common in kittens, just because of, especially if they're outside, just the amount of bacteria and stuff that's in the outdoors. So you can tell if they have a upper respiratory or eye infection if there's discharge around the nose or eyes, there's any sneezing, or if they're having difficulty breathing. So you'll always want to make an appointment for that to get some antibiotics to tackle that. For eye infections, they usually have eye drops. My kitten has both, so I'm handling that right now. So that's a lot of fun, but they're easy to handle usually if you catch them on time and you don't let it go, you know, too long without waiting. Pretty much anytime you notice any kind of nasal discharge or eye discharge, you'll want to get them seen at the clinic to make sure that you get it handled before it gets out of control. So then there's ear mites. Those happen just from, you know, being outdoors. So if you ever notice your kitten scratching at their ears a lot or kind of wiggling their head, there could be something in there that's bothering them. And that's usually treated just with a topical treatment and cleaning of the ears to make sure that all the mites are out of there. So again, make an appointment if you notice anything like that with your kitten to get those ear mites out, because they can cause problems and they're also probably really annoying. So make sure you get that tackled as soon as possible. Then the last one, it happens, it's what we call fading kitten syndrome. This is when one thing goes wrong and it tends to cause a domino effect in the kitten, and the kitten starts to what we call fade or crash. They just start showing signs of rapidly declining health, lethargy, listlessness, glassy eyes, pretty much as if they are dying. So there is usually when we want to interfere as quickly as possible to provide critical care. And what we usually ask is for the use of Caro syrup and sugar water to make sure that the kittens are hydrated and they don't become hypoglycemic. And what we usually ask, especially if, you know, the fading or crashing kitten is happening in the middle of the night, as they tend to do, we ask that you keep them in your home and just do your best to get them through that rough time, because transporting them could be just as bad. So we don't want to move them from their heat source and put them through the stress of getting them in the car and taking them to a vet or a clinic, because it can cause damage in the time that you're not spending trying to get that sugar water or Caro syrup in them. Do you have any tips, Maria, about fading kitten syndrome at all?
Yeah, so I just kind of want to add there for the fading kitten. I've been at the med clinic when fading kittens have been brought in, and really the reason we want you to stay home with the fading kitten is the vet and the vet techs are not going to be able to do anything else for it other than what you're doing. So they're still gonna push Caro and they're still gonna try to push fluids, but really it's just up to the kitten's body to decide whether it has the energy to fight it or it doesn't. So keeping it at home where it's on its heat pad, and you don't have the time that you're driving where it could be getting that Caro syrup every 3 minutes or faster if you're needing to do it more frequently. So the fading kitten stuff, it happens, and if it hasn't happened yet, it likely will happen to you. It happens to everybody. It happens to me. I just lost one the other day to fading kitten. So no matter how much experience you have, it's going to happen. So it's really important to not get discouraged by it, because in reality, kittens and cats and dogs, and all other animals for that matter, have large litters for a reason. And that reason is not every single one of them is going to survive. And the orphans that come into ACS, what we end up with as fosters, could be orphaned for a whole lot of reasons. Outdoors, mama dogs and mama cats abandon their babies if they think they're sick or something's wrong with them. It's just a fact. So some of these kittens that they're finding and turning into ACS for us to foster could just be abandoned by mom and dad because they sense something that's wrong with that kitten and we won't know about it. So there could be congenital defects. So something's wrong with it, and it might not be a visual defect. It might be an internal defect with its GI tract or something else. Not every single kitten is going to survive. Mm-hmm. We can do our best to help them survive, but in reality, we're all going to lose kittens every now and again. So it's just really important to not feel discouraged. I know it's hard not to feel bad about it and feel like it's your fault for any reason that an animal gets sick, but just know that it happens to every single one of us. Mm-hmm. And there's not anything that a vet or a vet tech can do differently to help it than what we put out in the pamphlet for fading kitten syndrome.
Mm-hmm. Yeah, and that's all good stuff to remember. And you can also remember that we have our foster form for a reason. Even if you feel like, you know, you did your best and maybe you are feeling discouraged, you can always post there and you will get tons of stories from other kitten fosters that have gone through the same exact thing. So don't forget that we are a community and we're here to help each other out. So this is Maria's specialty, so I'll let her sort of tackle this topic if she wants to.
So welcome to my world. So like we were just talking about, or what I was just mentioning with the abandoned, orphaned animals could have things wrong with them, and that's why they were abandoned. We'll go for an example right now. I have a kitten that's supposed to be 4 weeks old, and he weighs about like 140 grams. He's got a deformity in his head, he's got a deformity in his chest, and that's causing him to be stunted growth. He's still pushing through. We're working as much as we can, but some animals are just like that. And that's kind of my preference. I leave all the healthy stuff for you guys, and I try to take all of the harder to deal with deformed babies when I can. So these guys are, since there's something wrong with them, or I guess wrong isn't the right word, but something's different with them. They're more fragile, and they're definitely more prone to infection because their immunity is usually a lot weaker than what a healthy animal would be. And so they will develop more slowly. So we've had a lot of premature kittens come in for foster pleeing, and you'll notice when those pleas go out, they kind of look for more experienced fosters. So not someone who's bottle feeding for the first time, someone who can deal with the harder to feed stuff, because the premature kittens are very small, and they take a lot more to feed, and they definitely take a lot more effort to get them going and get them to grow up at a, they're definitely going to be a lot slower behind than kittens their age would be. All of these animals, special needs and premature, are going to take a lot longer to hit their milestones. So you might be bottle feeding the same kitten for 8+ weeks, if that's what it takes to get them to grow. So definitely, if this is something you're interested, keep in mind that their timeline is a lot longer than what a normal kitten's timeline is. So for example, the special needs stuff, I take in a lot of special needs animals, and I've had some special needs for 4 to 6 months. I've had a special needs for over a year before she got adopted. So not all of them are going to take that long, but some of the more severe stuff may take several months before they reach adoptable age. These guys, you're definitely going to have to monitor a lot more frequently with the weighing and keeping them warm, because they're not as developed as normal babies would be, and so they need a lot more care that way. Definitely needing to keep a better eye on them and more frequently. So if you're someone who definitely likes to sleep all through the night, or likes to get an extra 2 or 3 hours between bottle feedings, maybe these guys aren't necessarily for you. I don't really get a whole lot of sleep ever. So these guys are also going to have more issues with their digestive tract, especially with premature kittens. It affects the GI tract development. And so these guys are more likely usually to have diarrhea or have issues with aspirating, because they go a little bit slower with their feedings usually. And some people try to push a little bit too much at a time, and aspiration will lead to pneumonia or other respiratory issues, which could be fatal. So you want to keep an eye on both the amount that you're trying to push and how fast you're trying to push, because these guys need a little bit of extra time and care with their feedings. So I kind of went over the last bullets and the rest of them, but really the special needs stuff, it might not be obvious at first. So you could pick up just standard newborn foster, not a premature, not anything. It looks like a normal newborn kitten, or even a 2-week-old kitten, and you're feeding them, and you're doing everything by the book, what you need to be doing, and weighing them and everything, but they're just taking a little bit longer to grow. They may have something wrong internally that we can't see. Now, we can't do x-rays on every cat, we can't run blood work on every cat, but just know if your cat's not hitting every single milestone as it needs to, it's okay. You should make an appointment for the vet to see it, to make sure that everything you're doing is what we could be doing, or if maybe they need a little bit of medicine to help out. But don't get just discouraged just because everything's not going according to plan. Usually they work themselves out with a little bit of extra care. Like I just picked up a special needs kitten a couple days ago, and she was not using her back legs, and they thought she was possibly incontinent, and she came home with me. I got some pain meds and antibiotics on board, and now she's walking all over the place and climbing all over her kennel and going potty on her own. So sometimes they just need a little bit of extra help, but a little bit of extra help goes a long way. These guys are also more prone to having fatal issues though. So if you're someone who gets discouraged easily by like fading kitten, or can't necessarily handle the death of an animal very well, then maybe you should stray away from the special needs and the premature and kind of stick more with the healthy animals. Because it does happen a lot with the special needs stuff. Because like I said, usually when they have one issue going on, they usually have more that's just not visible.
And if you're interested in actually stepping up for kittens like this, for special or premature kittens, you can always let our foster team know. If you think, you know, you got what it takes and you have a good setup at home to really give these kittens the time and dedication that they need to grow and, you know, be healthy and get adopted, then that's awesome. So just let our team know, and then that way you can be one of our go-tos when we get these cases in, for sure.
Or if you end up with something like that accidentally, like like I said, if you pull a healthy or what seemingly is healthy and it ends up having some issues and that's more than you can handle, you can always let foster team know and they can plea it out to another foster who can deal with it.
Yeah, because we obviously don't want you to have to handle something that you don't feel you're prepared to handle, essentially. So that's a good thing to remember. So here are a couple other resources. If you're really, really interested like me, I just kind of went off on my own and I started learning more about kittens. These are a couple of places you can go to get more information. I Swear by Kitten Lady. I actually have her book, Tiny But Mighty. It's called Kitten Lady's Guide to Saving the Most Vulnerable Felines. And it's pretty much the most comprehensive guide book that you can have to fostering kittens. So it has a lot of information on feeding and illness and, you know, even things like marketing for adoption. So it's a great tool to have, and you can get it on Amazon or wherever you get books. But her website also has a lot of fantastic resources as well. There's also Alley Cat Allies. They mostly focus on, I believe, feral cats or community cats, but they have a lot of good things about kittens on there as well. Best Friends has some good resources on their website. Of course, they have some for dogs and cats normally too, but they have a few good articles on there about kittens and raising kittens. And UW Shelter Medicine, that the School of Veterinary Medicine has a lot of great, if you're really interested and you want to get into a lot of the science and stuff like that, they have a lot of good resources there. And then there's icatcare.org, International Cat Care, where you can get some tips on hand rearing kittens and feeding them and everything, just a different perspective on it if you're just reading everything that there could possibly be. So don't be afraid to go out and look on YouTube as well. There's tons of tutorials on feeding and, you know, stimulating them to go to the bathroom or whatever you need to know. There's a lot of good videos. So. Well, okay, so we have about 15 minutes. So if anybody has any questions, you can feel free to use the question and answer feature in Zoom, or you can just type it in the chat. Just make sure that the to portion in your chat says to all panelists and attendees and the host, or what the option is so that everybody sees it, and we can answer them as they come in. Can you show us how to feed a kitten and help it go potty? So I can't right now, but there are some great YouTube videos. Kitten Lady has some that are specifically on bottle feeding kittens and stimulating them to go to the bathroom. She shows you pretty much step by step. So if you haven't checked out her channel yet, that is probably one of the best resources. She has like a great setup for how she bottle feeds kittens. And she also goes into syringe feeding kittens in case the kitten isn't really responsive to the bottle. And for those who are super, super, super experienced and have maybe some vet experience, she also talks about tube feeding kittens. So, you know, if you really want to know about that, you can go check out her stuff. And it's a fantastic resource. So the second question says, how do you get kittens to stop biting and biting hard? You got any tips for that, Maria? Is my cat started biting?
So normally the kittens that are biting hard are, I'm going to guess, singletons. I don't really see that too much when they have litter mates, mostly because they teach each other manners. With the biting, I mean, you can try to redirect them to a toy or put them away until they calm down a little bit, and then let them back out when they've calmed down. I don't really deal with that too much. And
well,
when I do have to deal with that, I kind of just put them back in their kennel, kind of like a timeout until they've calmed down and learned what they did was wrong.
So what I did with Otto, he was a singleton, and so when I brought him home, he had a big biting problem, and he still kind of bites me a couple times, but it's not as hard. So, but he had a big biting problem. He didn't realize how hard he was biting. So my recommendation is to get a second kitten because that's the only way I got Otto to stop biting as hard, because once he realized how much it hurt, he kind of settled down. So it's always better to have at least 2 kittens, whether it's your personal cats or foster kittens. Sometimes you have to do a singleton, but you know, if you can get a second one in there, they'll help each other, teach each other those manners and how to stop biting. But
yeah, if you're raising a singleton, you can always post in the forum and ask if anyone has a similarly aged singleton or litter that you can either transfer that foster to, or they can take on your foster. I kind of want to go back after we're done with this to the feeding question, and go over that a little bit, because there's some stuff we missed on the feeding portion of the Zoom.
Oh yeah. Go ahead. Whatever you wanted to bring up.
So as far as the feeding and helping it to go potty, so kittens under 3 weeks old need to be helped stimulated. And so a lot of the time people don't realize that you stimulate before feeding as well as after. And that's just, I mean, if you go take a nap, you're going to go to the bathroom before you go and drink another drink too, because your body has processed that food and the liquids, and you don't need to go potty just after you eat. So that's kind of a tip when you can't get a bottle baby to eat food, or if they're a little bit finicky with the bottle, try stimulating them first before you offer them food, because it usually empties a little bit of space for them. And I've had a lot of success with kittens eating a lot more after that as well. So you're going to want to use like a wet washcloth or a baby wipe. You don't want to use something dry and rough, because let's face it, nobody likes rough stuff rubbing on your sensitive parts. So you want to help them go to the bathroom and stimulate them for a little bit. You don't want to just wipe a couple times and say, oh, it didn't go to the bathroom, because it takes them a little bit to get stimulated. So mom would be licking to clean them down there, and that's how she would stimulate them to go potty. So you kind of learn what works best with your kitten. So stuff like, maybe if it's a finicky kitten, you can use a miracle nipple. They sell them on Amazon, and what it is it's just a little rubber nipple that goes on top of a syringe, and it's designed a little bit differently than the nipples that go on bottles are. It's a little bit thinner, so it's easier for some babies to suckle from, especially if it's like a premature baby or something that has another issue like that. So if you can't get them to suckle from the bottle, just syringe feed them until they can suckle.
Those are good tips. Let's see. Okay, here's another one. 4-week-old kitten placed small plate of canned kitten food but hasn't eaten it yet. How to encourage him to eat regular food as opposed to bottle feeding? So I can tell you what I did with Otto. He was also a little finicky. He wanted the bottle only when he was, I think he was about 6 weeks when I was trying to switch him over. There are a couple different tips and tricks that you can try. It just depends on the kitten and kind of what will kind of convince them to try the food. What I had to do was take the nipple off of the bottle. So I put the wet food into the dish. Of course, I had it mixed with a little bit of formula so it tasted familiar. And I just scooped some of the food with the nipple kind of towards his mouth. And that's how he figured out, oh, you know, I can just eat it from the plate, so, or from the little saucer. But some people try to do it with their finger, so you can try to offer it on your finger, or on like a little tongue depressor or something if you don't want to use your hand. or you can try a little spoon. There's a couple different techniques, and it'll just depend on your kitten and how, you know, how particular they are with when you're trying to wean them onto the kitten food. But like I said, you'll want to meet them where they are. If they're not quite ready, you know, take some time, have some middle steps in between, and just make sure that you're supplementing. Even if they don't decide to eat everything that you're offering them, you still want to give them some formula or some gruel in a bottle if you need to, because it's not like with toddlers where you say, if you don't eat it all, then you don't eat. They still need to eat. So like I said, meet them where they are.
Yeah, it's kind of the same thing as really just any kid. A lot of times they don't want to try what they're not used to. So you're going from suckling on a bottle, which is basically the same mentality as suckling from mom, which is natural to them. Eating the gruel isn't necessarily a natural instinct to them, especially that young of age that we want them to start eating like that. So what works for me is just to get them sampling it. So like you were talking about with the spoon feeding, or I've even gone as much as grabbing a little pinch of the food and putting it in their mouth so they try it first. And then sometimes they're kind of like, oh, hey, that was kind of good. I kind of like that.
You gotta give them a little taste of it first. Okay, let's see. Next question says, any suggestions for managing a lot of kittens with a variety of feeding needs? I have several bottle and several gruel, as well as some with full-on wet food needs.
Oh, welcome to my world.
Go for it, Maria. I don't do that. I'm not that crazy.
So I've got a little bit of everything going on right now. I've still got a mom with some babies. Her babies are actually on wet and dry food already, but she still lets them nurse. And then I've got two cages of gruel babies, and then I've got 4 cages of wet gruel / dry food, and then I have a bottle baby. So really, I don't have very many tips for managing it. You go with the flow, and you just decide that you never want to sleep again. That's kind of how that goes. So really though, as far as managing them, it just depends on how you want to do that. So you could make a big like water bottle or half a water bottle or something of formula ahead of time if you're making gruel with formula, because some people with the older kittens do gruel, but they do it with water, so it's a little bit easier. But you can pre-make the gruel into a big water bottle. I've done that before, and leave it in the fridge, so you just warm it up as you need. That way you can make the whole thing, but you only use what the kitten's going to eat, and you can add more if it's eating all of it. But that way it's not sitting out. That's it's kind of hard. If it's getting to be too much, you can always transfer if you need them to be transferred. But really, it's just all about making it work for you. So every foster does everything just a little bit different than the next foster. So something that works really well for me might not work for somebody else. I usually make, since I have a bottle baby, when I make the formula for the bottle baby, I make extra formula, and then that's when I mix up the gruel for the other kittens. So my gruel kittens eat probably a little bit more frequently than they need to, but they don't complain, so.
Don't think they would. All right.
Nope.
Here's one more question, it looks like. I'm curious about gruel babies. Do you offer the gruel at all times? And since they can have different timelines, what do you look for to know when they're ready for the transition?
So as far as gruel being left out all the time, since it is formula, just like with human formula or any other animal formula, you don't want to leave it out all the time. So what you can do in the times that you don't have the gruel mixed with the formula. So say your kitten's eating gruel and you're feeding them the gruel every 4 hours or so. If you're concerned about the kitten being hungry in between them, you could have the gruel made with formula for a while, and then take that away and give them a gruel that's made with water, so you can leave it sitting out for longer, and do that in between. it's not going to hurt them to switch from formula to water when they're doing gruel. All it's going to do is keep them hydrated. So you can do it that way. I also, when I switch things to gruel, I always offer a dry food. So I don't expect a 4-week-old kitten to switch to dry food just like that, but they start getting curious and they'll sample things. So if they're getting hungry in between their gruel feedings, they'll go and try, oh, this kind of smells good, and then learn that they like it. And so sometimes they'll start filling themselves with the dry food in between their gruel feedings, and so they're not hungry in between their feedings. As far as the knowing when they're ready, each kitten is going to be completely different than the next. And each foster is going to be completely different from the next. So I know fosters like Lori and I love to keep them on the bottle as long as we can, because it prevents that messy gruel stage. So there's a stage when you're starting to transition to gruel, especially if they're like 4 weeks old when you start putting them on gruel, where they just kind of like face dive in the food, and they just get it all over the place, and they need more frequent baths. And so I let them suckle from the bottle as long as they want. But it is nice to start switching them over to gruel. So most of the time I pay attention to teeth. When they start chewing on the bottle more than they're suckling on the bottle, that's when I start trying to introduce the gruel. That way they're also not damaging all the nibbles for your bottles.
Yeah, yeah, you'll run out of those really quick.
Yes. So just kind of look for that. If your kitten is just steady suckling from the bottle and not chewing on it or anything, and you're not in a rush to get them on the wet food, you can let them suckle for as long as they need to. If you're continuing formula, they're not going to have an upset stomach from that. But if you stop formula feeding and then you try to start again, that's when you start running into digestive issues. Or if you pick up what should be a 5 or 6 week old kitten and it hasn't been on formula in a long time and it's supposed to be eating gruel, and then you start trying to let it suckle from a bottle, that's when you might start getting the upset stomach stuff. So basically it's just whenever you're ready to transition them. And then when they start chewing on the bottle is really the best indication. Or when they start getting close to 2 pounds, then you should probably switch them.
Yeah, yeah, when they're ready to be adopted, maybe. Yeah. Okay, let's have this one last question. I've never fostered kittens, but I see a lot of needs for bottle babies. I'm scared to take them in because I don't know how to feed them so frequently. Any tips for feeding them overnight, setting alarms? What do you do, Maria? Because
so that's kind of just all on your personality. So me personally, I'm such a light sleeper. If a bird tweets outside my window, I'm awake. And that's how I've been my whole life, and I never really get much sleep. So if a kitten or a human child or something starts stirring in the room that I'm in, I'm usually awake anyway. So I do set alarms though, because sometimes I hit a deep sleep and I need to be woken up. But I set alarms, and I usually, so it just depends on how you sleep too. So I sleep by myself in my bed with a million animals. So I usually have the kennels or something next to my pillow up at the top of my bed. That way I can hear them if they're crying or if they're making a lot of noise moving around or something. But that's just kind of all personal wise what works best for you, because some people sleep like the dead and they might not wake up to alarms. And if you're one of those people, maybe it's not the best for you to bottle feed. Or if you are one of those people and maybe you can't get up every 2 hours, but you can get up every 3 to 5 hours or something, then maybe you should start with bottle feeding from ages of like 3 weeks on, because they can go a little bit longer in between feeding and they're a little less fragile at that age. Because the newborn to 2 weeks, they're a little bit more fragile, and if you miss a feeding or something like that, they could fade just from being hypoglycemic. So there's not enough sugar in their system, there's not enough food to process and stuff like that. So if you want to bottle feed and you think you can get up every like 4 to 5 hours throughout the night with an alarm, start off with a 3-week-old kitten where they're almost getting to that gruel age and they're less fragile. It's probably the best age range to start when I tell people to get involved with bottle feeding, because they're less fragile and easier to deal with at that age.
For sure. All right, well, that's all we have for today. If you guys still have questions about fostering kittens, there's of course our Facebook foster forum. If you're not a part of that yet and you are a foster, go ahead and go join that, because there's a lot of handy tips in there. There's a lot of people who can answer questions, and our staff is in there as well to answer questions or concerns. And as always, you can email the foster team at foster@sanantoniopetsalive.org. Or if you have medical questions, you can also email them at fostermedical@sanantoniopetsalive.org. So those emails are monitored as often as they can be, so you'll get a response as soon as somebody sees it and is able to get that to you. But yeah, if you have any questions about fostering kittens, don't hesitate to ask, and we're always happy to add more neonatal kitten fosters to our foster community, essentially. So thank you, Maria, for being here and talking with us about kittens. You're so knowledgeable. I love it.
Yeah, no problem.
And thanks to everybody who is here for our second foster session. I hope it answered some questions and gave you some information you didn't have. So keep an eye out. We will let you all know when we have our next session coming up. We'll post it on the foster forum, and we'll send out emails and reminders. So we're just kind of getting our schedules put together and getting more sessions set up. So thank you all, and I hope you all have a wonderful day, and be safe out there.